I am Dr. Sarah Mitchell, and today we are going to talk about a very common but often silent condition called osteoporosis. Many people do not realize their bones are becoming weak until they experience a fracture after a minor fall or simple injury. Because bone loss happens gradually and silently, osteoporosis is sometimes called the silent bone disease. In this video, we will discuss what osteoporosis is, why bones become weak, early warning signs, risk factors, diagnosis and treatment, prevention and bone health, lifestyle management, and common myths about osteoporosis. So let's begin. What is osteoporosis? Osteoporosis is a condition in which bones become weak, fragile, more likely to break. Healthy bones are constantly renewing themselves. As people age, bone breakdown may happen faster than bone rebuilding, leading to reduced bone density. This makes bones thinner and weaker over time. Why osteoporosis is dangerous? The biggest problem is that osteoporosis often causes no symptoms in the early stages. Many people only discover it after a fracture, sudden back pain, loss of height. Common fracture areas include hip, spine, wrist. In older adults, fractures can seriously affect mobility and independence. Early warning signs of osteoporosis. Loss of height. Gradual height loss may occur due to weakening spinal bones. Type 2C, back pain. Tiny fractures in spinal bones can cause chronic pain. Stooped posture. Some people develop a curved upper back posture over time. Momkustam. Frequent fractures. Bones may break more easily than expected. Even minor falls may lead to fractures. Monkus. What causes osteoporosis? Bone strength depends on calcium, vitamin D, hormonal balance, physical activity. Several factors can contribute to bone loss over time. Risk factors for osteoporosis. Aging. Bone density naturally decreases with age. Menopause. Women are at higher risk after menopause because estrogen levels decrease. Low calcium and vitamin D. Poor nutrition weakens bones over time. Smoking. Smoking negatively affects bone health. 3P. Excess alcohol. Heavy alcohol use may increase fracture risk. Success. Lack of exercise. Bones become weaker without regular physical activity. Success. Family history. Genetics also influence bone strength. Success. How bones stay strong. Bones respond to physical activity and proper nutrition. Weight-bearing activities help stimulate bone strength. Important nutrients include calcium, vitamin D, protein. Healthy habits during younger years also affect bone health later in life. How is osteoporosis diagnosed? Doctors may recommend bone density scan, DEXA scan, blood tests, medical history evaluation. Bone density testing helps estimate fracture risk. Treatment options. Calcium and vitamin D supplements help support bone health when needed. Bone strengthening medicines. Certain medications help slow bone loss or improve bone density. Hormonal treatment, sometimes considered in selected patients after menopause. Fall prevention. Reducing fall risk is extremely important in osteoporosis management. Exercise for bone health. Regular movement helps strengthen bones and muscles. Helpful activities include walking, strength training, balance exercises, light resistance exercises. Exercise also reduces fall risk. Healthy nutrition for strong bones. Calcium-rich foods. Examples include milk, yogurt, cheese, leafy green vegetables. Vitamin D. Vitamin D helps the body absorb calcium properly. Sources include sunlight exposure, certain foods, supplements if needed. Damgas. Balanced diet. Healthy overall nutrition supports bone repair and muscle strength. Why falls become dangerous. In osteoporosis, even a simple fall can lead to serious fractures. Hip fractures in older adults may lead to surgery, long recovery periods, reduced mobility. This is why prevention is so important. Emotional and lifestyle impact. Osteoporosis may affect confidence, mobility, independence, daily activities. Fear of fractures may also reduce physical activity, which can further weaken muscles and bones. Preventing osteoporosis. Stay active. Regular exercise is one of the best protective measures. Chakasa. Eat bone-healthy foods. Good nutrition supports lifelong bone strength. Avoid smoking. Smoking weakens bones over time. Chatasa. Limit excess alcohol. Heavy alcohol use increases fracture risk. Mercury. Maintain vitamin D levels. Healthy vitamin D levels are essential for strong bones. Common myths about osteoporosis. Mercury's myth. Osteoporosis only affects women. Reality. Men can also develop osteoporosis. That's myth. If I don't have pain, my bones are healthy. Reality. Bone loss may happen silently for years. Myth. Fractures are just a normal part of aging. Reality. Healthy aging should not automatically mean fragile bones. When should you see a doctor? Consult a doctor if you have frequent fractures, notice height loss, experience chronic back pain, have strong osteoporosis risk factors, are postmenopausal and concerned about bone health. Early diagnosis can help prevent serious complications. Final message. Osteoporosis is common, but it is not an unavoidable part of aging. Healthy habits, regular exercise, proper nutrition, and early medical care can help protect bone strength and reduce fracture risk. Your bones support you every single day. Take care of them throughout your life. Closing. If you found this video helpful, stay informed, prioritize bone health, and encourage your loved ones to take osteoporosis prevention seriously. Thank you for watching.